would say it is the families that we have been able to impact, and knowing that their lives are better because of the support and resources that we have given to them. I am a results-driven person and performance-driven, accomplishments, all those things. I love driving for those, but I think in this one, I think this is something you can't really quantify, because I could say, oh, it was the summit, or oh, but really it's the families, it's the women, it's the kids, it's the people that we know are, living a healthier life, being positively impacted. Hearing those success stories, I think they mean the most to me. They're the things that I can't hang up on my wall necessarily, but they're something that I can go to bed at night knowing, like, all right, you're doing something to leave this place better than what it is now.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 24. Hi everyone, my name is Omari Richards. I hope that you all got out there and voted today, or sometime before, hopefully. But I hope everyone's staying safe, doing well. This is my new humble abode. So within the next couple of weeks, you're definitely going to see some more things on the wall. Probably the next couple of months, you're going to see some things on the wall. I really want to set up here to have some like in-person interviews when that is cool and whatnot. But I'm excited to bring you this guest. I think she has a very fascinating story, and we get some insights before LinkedIn gets some insights, and some public health millennial first. So definitely I hope you enjoy this episode, and definitely subscribe if you haven't. Check me out on Instagram at the PH Millennial. Thank you. Okay. 3, 2, 1. Today, we have a co-founder of the consulting company WMC Public Health Consulting. She has completed her Bachelors in Biology and Anthropology at Penn State University. She has a Master of Public Health from Grand Canyon University. She has had a focus during her career at both clients and populations to improve health, wellness, and preventative health measures with... God, see, this always happens to me, and I feel like when this happens, the guests feel more comfortable. So I'm glad it happens. Okay.
No, it's a lot. It's a tongue twister. It's all those fun little tongue twister words.
Improve health, wellness, and preventative health measures in fitness and nutrition. Okay. Take number 2. Today, we have a co-founder of the consulting company WMC Public Health Consulting. She has completed her Bachelors in Biology and Anthropology at Penn State University. She has a Master of Public Health from Grand Canyon University. She has had a focus during her career with both clients and populations to improve health, wellness, and preventative health measures in fitness and nutrition services. Currently, she's pursuing her PhD in clinical psychology at Grand Canyon University. We have Liz Simpler, MPH, CWWS. Welcome to the show, Liz.
Hi, thank you so much for having me. I'm so excited to be here.
Well, I'm really glad to have you on the show. So thank you for taking time out of your busy day to be on the show. So how are you going and coping during these crazy times?
Man, pandemic life. I know. I am okay. I think it's pretty up and down. I'll just be honest. I'm really working on that to just not always say, yeah, no, I'm great. It's crazy because the area that I live in, I think they're pretty anti-pandemic. So people here are like, it's no big deal. Yeah. And I'm like, I work in public health. It's a big deal. So, doing all the things, trying to just stay mentally there. Exercise helps tremendously. That's like that and bubble baths. They're my 2 coping mechanisms right now. How about you?
Well, I've been doing well, just getting settled in this new environment in North Carolina. Can't complain. Like, for the most part, everything's going well. Podcasts, I starting back interviewing people, and I'm excited about that. So I'm just glad to have you on the show, and I'm glad we continue to share great value to people who listen.
Absolutely. Absolutely.
So how do you identify and tell us about your background?
She, her, hers. My background, let's see. Well, In what sense was
Like your personal background. Sorry, I should have said.
Yes. So I live here in North Carolina currently. I actually am born and raised in Pennsylvania, North Central, the middle of nowhere, very cute little area. I moved to the DC, Maryland area after undergrad, and I was working there a lot. And I really, I didn't realize, do you ever live in a place and you don't realize how much you loved it and you really miss it until you don't live there anymore? Yeah. And then I moved to North Carolina. So I'm here with my family currently. I'm just shy of Raleigh, North Carolina, so about 30 to 45 minutes south of there. And, I've got my little furry babies around here as well. So that's just a little snippet about me.
Okay, that's great. That's awesome.
Mm.
How many dogs do you have?
So I have a dog and I have 2 cats. And then there are 3 children that live in our house also. So it's quite a circus at any given moment. It's very entertaining. So.
Well, I'm glad I guess that's keeping you busy, so that's good to hear.
Boy, oh boy, does it.
So what does public health mean to you?
That's such a good question. To me, public health is the one thing that I do love about it, and I'll say this first, is how broad it is. I feel like this is one place where there's really something for anybody who's interested in health and wellness, and population wants to look at education, wants to look at the study of disease, wants to do data statistics, global health. The sky is really the limit in which you take public. And I think that's the biggest thing to me is it's how we study health and wellness and how we apply it to a population. And there are so many things that go into it, right? And so many under it as a category, things that I would never have considered. Like with one thing I saw this week was about workplace safety, and I was like, wow, that is one. Or cyberbullying. I was like, wow, those all really do fit into public health. So to me, I love all the diverse learning different perspectives. So
Yeah, and that is one thing to say about public health. It is everything, and it is everything in between of everything. It just touches on so many different things. That's why it's such a great field, I guess, to be in and to get to know more.
Yeah.
Yeah. So so before we jump into the I guess the formal parts of the podcast, I think it's on your LinkedIn page. I saw that you said that you say co-parenting, and I think that was a powerful thing to just see, because that's not something you see every day. So like, just talk about that a little bit.
Sure. So I like to phrase it like that. One thing that I have learned in working in this field is to expand my mindset. When my partner at WMC, Gianna, she's actually my business partner, we formed WMC together. We really wanted to focus on working mothers' maternal health. And as time went on, we realized, okay, well, we need space for parents. And, we learned so much more so. And I think it's really important to say things with co-parenting also gets a bad name. So one, it's a buzzword in the divorce community, which I am not, but I like to look at parenting from the perspective of partners. And when you're doing it from that perspective of, like I said, co-parenting, you're both working together, or everybody involved, right? That whole "it takes a village" conversation is really something that we talk a lot about with WMC. So that's why I say co-parenting, because there's just so many people involved with any given child. My situation is pretty unique also. So I actually, fun fact, have not given birth to a child. So my munchkins are all my niece. I'm her guardian, so she's 3, and then my fiance's 2 kids, 6, 4, and 3. I'm like, they've aged, so their ages. So that's kind of how I reference that. And again, working with providers of their child care. So you learn a lot.
Yeah. Okay.
That's
awesome.
where that comes from for me.
Awesome. That is a fun fact. I did not know that about you.
Yeah.
Okay. Awesome.
Kind of fell into motherhood there. It just poof, one day there it was.
And how do you adjust to that?
It was a big adjustment. Yeah. So I have a really big family. My dad is one of 7, and he's the baby. So I was always babysitting everybody's kids, and then I was a nanny through college, undergrad. I don't think anything prepares you when you're like living with them full time. And for me, I'd always been, just me and my pets coming and going as I please. So it was a big adjustment. I think that it definitely helped that I had a lot of auntie experience and whatnot, but it's been really rewarding, challenging, but rewarding. So definitely a big change.
Okay, well, and I see that you work in that space, so it definitely is probably like very rewarding in some instances also when you're able to help others. Um, yeah.
Yeah,
So let's
that's
talk
the
about
best
you.
part.
Yeah. Okay, I'm glad to hear that. So let's talk about your bachelor's in biology and anthropology at Penn State University. So what is anthropology, first of all?
Yeah. Anthropology, the study of people. And again, another really broad you could go. Physical anthropology, that was my kind of area of interest. And bones, we used to call it levels of deadness, not the most attractive phrasing, but accurate to, cultural stuff. There's more archaeology type things. A lot of schools house those all in the same department. So that was more my side of.
And what was your thought behind getting your double major, biology and anthropology?
Yeah, so honestly, when I went into undergrad, I had always wanted to be a veterinarian. Turns out I'm not great at chemistry. Oh. So, yeah, I had to restructure things a little bit. And also, after doing some interning, I'd found that was not for me. But so what I really enjoyed was the biological component of anthropology, right? I had started trying just to take some classes and see. I was always really interested in people and science. And I thought, well, I had switched out of a pre-vet major into biology because that was just a more broad focus. The idea, at least at that time, was okay, if I have this degree, this bachelor's degree, I could go in a bunch of different directions there. And then I fell in love with anthropology and I was like, wow, I'd really like to do both. And the way Penn State does things, at least at the time, can't speak to now, it was a few years ago. Seems like yesterday. Anyways, they do it, and it's like the best way to describe it is like a tree. And so when you double major there, they recommend that you don't do two majors that have nothing to do with each other. And so it was really easy for me to classes. So what I needed for my biology major, I also needed for my anthropology major. So they were easy to say, hey, I'm going to get both of these. And like I said, I was horrible at like physical chemistry and organic chemistry. I was like, I could be a chem minor too. That'd be a good idea. It was not. That did not happen. So
Yeah, I definitely understand you there. Like chemistry definitely wasn't my strong suit, but yeah, and I also went into undergrad as a pre-vet major. Fun fact.
no kidding. So crazy. I
Yeah,
love that. You don't meet many people that say that.
that is true. That is true.
Mhm.
So let's talk about your research laboratory manager at Penn State University. This was during undergrad, correct?
Yeah, it was. Yep. I did a lot of research. I've always wanted to go towards doctoral studies, towards, PhD research and whatnot. And I've just been kind of trying to find the right path for that. And the idea was at the time, my advisor, slash, was his that I was running, and I was, helping to teach his classes and all of those things. He was really trying to groom me to go into graduate school after the fact. So yeah, it was an incredible experience. I highly recommend, if you have interest, even if you don't have research interest, to get into a lab. It's just great experience and a great resume builder. So many good skills come from that.
Okay, and what sorts of research did you do, if you don't
Yeah.
mind like talking about it a little bit?
Oh no, I'm talking about it. It was really fun, honestly. So we focused on primates and large carnivores. So one research lab that I worked in, because I did end up working in two, was around, how primates move and studying the femoral and humeral heads. Ugh, there we go, tongue twister, of these, and you can tell a lot from this, and it helps to go back to the fossils. And on carnivores, we studied mastication, so chewing and diet, and you can do the same thing in primates. So that was what we were working on there. It was fantastic. I think I was too young to really appreciate that work at the time. I but yes, it was very fascinating, interesting stuff. And the other good thing about doing research is if you have a good professor, you can get some publications out of it, even if they're abstracts, presentations, which I was fortunate enough to get that chance and whatnot. So yeah, it was cool.
Okay, that's dope, and yeah, that definitely isn't something that you hear everyone do research on. So that's really cool. So,
Yeah.
so you graduated and then you became an account manager at Vocus. So, what is Vocus and how did you get that role?
Well, the academia career for me at that time, I was so scared. I was scared. I was supposed to be going to Duke at the time. North Carolina has evidently been calling me for a long time. I'm finally here. And in the meantime, I was really getting passionate about wellness and just trying to figure it out, honestly. And the good thing about Vocus at the time was my job as an account manager was really a lot of client relations and teaching them how to, at the time, use this media platforming and press releases, things of that nature. So it honestly did not go that well. And at the time, like I said, I was very passionate about fitness and nutrition. So I was doing a lot of personal training, nutrition stuff on the side, trying to find my way. Um, I was like, I'm not ready to go into this world of academia, and I want to explore some other passions. So that's what I did, and that was my experience at Vocus.
Okay, and
So
how long were you there before you decided to do your MPH, and what was like the motivation for that switch?
yeah, so I think I was at Vocus for honestly not that long, maybe a year. I was really unhappy. It wasn't what I wanted. I knew I just needed like a break. Um, and so my MPH actually, I did not start that until I was working at Life. I was working full time in fitness and nutrition, doing training, taking clients, doing group coaching, metabolic coaching. I got into that thinking, yeah, I'm gonna go down this path. I'm gonna go down and I'm gonna explore that. And what I found was that as much as I loved that working on one-on-one and I loved my clients and they have become, honestly, now that I'm done, some of my best friends, um, I wanted to help populations of people that didn't necessarily have that kind of access to resources. And that's when I actually started my MPH, and I was, I think, 25 when I started. 'Cause somebody asked me that today, if they thought if I thought that they were too old to start in their mid 30s, and I would say absolutely not.
Hmm.
Uh, and so that was my, that was my big thing. Is I was like, there has to be more to this.
Yeah.
And I also could not have imagined myself just grinding out working in a gym for the rest of my life. If that's for you, that's great. That's awesome. I support that. I have friends that's their passion, that's their calling. But I knew I wanted to expand from there. Preventative wellness is fantastic, but yeah. So that's how
Yeah.
that all sort of happened.
Yeah, fair enough. How did you hear about the Masters of Public Health? Was that like something that you heard about undergrad or something?
No, actually, I didn't know anything about public health for the longest time. I mean that I found out I was kind of working in it unintentionally, working in wellness and preventative wellness. Um, my business partner, Gianna,
Hmm.
actually, she had done her MPH. She had finished hers not that, I think maybe a year before I started mine,
Hmm.
and she was planning her wedding and she was finishing her, her practicum experience, and she was telling me about it and how much she loved it, and I just remembered these conversations. Like I was looking at a bunch of different options career-wise
Hmm.
at the time, both medically and then the health field, and I was like, no, that's the one. That's the one. That's for me. So that's sort of how that happened. And she
Okay.
had gone to that school too. She had great recommendation and references, and was just like, no, this is a great program. You'll check it out.
Okay, awesome. So you got your MPH at Grand Canyon University. Did you have like a specific concentration?
I didn't. They actually don't offer that there. This is one
Okay.
of the things that I think I might do differently, or I might have done differently. But at the time, I was just so excited to get started and to dabble they had the one thing I loved about their program was it was really well-rounded. So you
Mhm.
took a lot of different classes, and all of now what I've learned later is all these other different concentrations that you might find that you're interested in. And the way that setup was that you could make your capstone and your practicum, those projects more focused on the concentration you wanted to go in, as long as you got
Yeah.
site approval. So,
Okay, that makes sense. And
mhm.
did anything like stand out during your MPH program that you like to talk about?
That I wanted to like move into the area of public health.
Yeah, sure. Like, yeah, how like what areas interested you in in your MPH program? Like, what got you passionate or yeah.
Yeah, I love that. That's such a I really enjoyed the epidemiology classes.
Mhm.
I learning about the cultural approach to public health. Uh, and of course, my all-time favorite became maternal and that was actually, you know, where I ended up landing with all of that, which I think is just is crazy. Because at one point I was like, maybe that type of work, I just didn't know how to get there, and public health was just the most perfect path to finding that. So.
Yeah, awesome. So then you graduated with your Master's of Public Health, and you began working as a public health intern, or was this during your MPH program at Howard County Health Department?
Hmm. Yeah, so that program I got to do my internship a little longer with them.
Mhm.
And the way that that worked, I actually really lucked out and got a paid internship, which I was pretty excited about. That was that was sweet. So that program it was my first experience working with the health department, and I remember being like, "Wow, look at all these programs and services!
Mhm.
This is incredible!" And going to these meetings, and just being like, "Oh my gosh, I'm working in public health. How cool is this?" um, but yeah, that was a really wonderful opportunity. That was working. I did a couple of different things for them.
Mhm.
Some of which was worksite wellness type things. The CDC had a grant program that they had paid for Healthiest Maryland Businesses, and that later actually extended into my next role as the regional coordinator for that. And then it was also I've done a lot of health communication and education facilitation things that also work. And then a tiny bit of epidemiology work, but more so with like not infectious disease, unfortunately. That would have been cool, but didn't that didn't happen. At least not yet. Who knows?
Yeah. So
Future.
so how exactly did you get into the role, and what is the Healthiest Maryland Business? Like, did was it like you were doing your internship and this role opened up and they're like, hey, you'd be perfect for it, or did you have to apply for it? And they also said like, I don't know, tell me what happened.
Yeah, it's kind of a crazy story. I feel like there's
Mhm.
so many of those in my history here. But I was brought on in two roles as the intern, and then this role sort of opened up. And then what ended up happening was Howard County actually was like, we no longer want to host it's a grant funded program. We no longer want to host this program.
Mhm.
And so they put out so the state of Maryland grant and was like, okay, we're going to put out an RFP to the state and see if any other health departments, anybody else would pick it up. And so I actually left that health department and I was working with my colleague
Mhm.
who from Healthiest Maryland Business to write the proposal for the RFP. And she's like, we'll host you. You can do contract work remote in, that's fine. Um, it was a little, I will say this, it was a good learning experience because I
Mhm.
had quite challenging managerial experiences at the health with people. Some people just don't believe in the possibilities of corporate wellness and not, I don't want to say corporate wellness, but just wellness in general in the workplace. So anyways, she and I worked together on this grant and we got it, and it kind of lucked out there. um, that was a lot of work. The grant writing is another fun experience I think you gain is when you work in public health, if you haven't had it yet.
Yeah, absolutely. Definitely. Did you get any grant writing training in school, or did you just pick it up on the work in work?
Both. I think so in undergraduate, we applied for grants because we traveled quite a bit, and to do research, you pretty much have to have that. So
Mhm.
I went to South Africa in my undergrad for research, and that was all paid for via grants. So we had to write those. The grant writing experience, I remember getting drafts back that were
Mhm.
just so many red lines on them, but you get better the more practice you get. So, and there's classes too. I wish I hadn't had time for one of those, but I would recommend it of the chance because it's a great skill set.
Awesome. And what was I gonna ask? So what exactly is like corporate wellness, and why is it important?
Yeah, so I think different people do it differently.
Mhm.
Um, the way that the CDC, they have a bunch of different programs around the country that are they're just fantastic. And really what the whole goal is spend so much time at work, right? At least,
Mhm.
pre-pandemic before everybody's home and, navigating all this. But we spend so much time working or at the office. I think on average, most people it's a minimum of 6 hours, maybe if you're lucky. And maximum of that is like 12, 14 hours, like think about medical professionals. And so the idea is this is an area that we can impact wellness. And this is something that employers need to care about. And they need to provide options and resources and trainings, and just so many things that can go into those options. And working through chronic illness and whatnot. And then when you dive in deeper, you find, wow, these policies do a lot of things, and I think that was kind of where when I started looking at that, I was like, wow, okay, there's some stuff here. So, I'm trying to improve those health outcomes of your workforce. And then the one thing that some people really feel slimy about is the fact to, I don't want to say pitch, we have to get the employer on board with why they need to care about this. Some people really do care benevolently about their culture and their employees, and some you have to be like, hey, this is going to save you money, because if you have healthier employees, they're not going to be, not so much about absenteeism anymore. It's about presenteeism, et cetera. Anyways, there's so many things I could go into with all of that, but that's kind of the gist of it. So that helps with that one.
Yeah, thank you for sharing. And so what were like the main roles you did in your central region coordinator position?
So a lot of those things are the big roles were, health communication was really big. And that would be, creating resources, creating whether it was a flyer, a newsletter, something like that to put out that said, hey, these are the events that your employees can take advantage of. These are resources. These are health observances that are happening this month. These are options for strategic planning. We did a lot of strategic planning of like, how do you actually have a wellness program? How do you implement it, et cetera. It might be actually doing technical assistance and training with a wellness coordinator and actually saying, hey,
Mhm.
like this would be a really good policy. It might be diving into an employee handbook. It might be, if some companies have insurance data or data from like a health risk assessment that you can
Yeah.
analyze, and you could analyze year over year and see what's working, what's not. So those are just a few of the things.
Okay,
So it's pretty
awesome.
cool.
Yeah, well, thank you for sharing. And
Mhm.
then from this position, you transitioned into CEO and co-founder at WMC Public Health Consulting. So what got you thinking to start your own consulting organization?
Yeah. So, like I said, Gianna and I have been friends for a really long time. I actually used to work with her husband. That's how we met. And we just stayed in touch after we met in Maryland. They moved back to California. And we were just talking the one day. We'd heard Dr. Huntley's podcast actually about starting a consulting, you know, and how broad it was, and that you could start a business. And my contract was actually ending. The Maryland Department of Health had moved the funding again, and so they'd put it into something else. And so the regional coordinator positions, they were going away.
Mhm.
Um, it also faced a bit of discrimination in the workplace. I mean, it's not a fun topic, not something fun that anyone to go through, or anybody in general, just about having children, and really starting to with this Healthiest Maryland Business program, lactation, and how those policies were really important, and the protections that the Affordable Care Act put in place, and
Mhm.
kind of a perfect storm of all this. And Gianna and I were just like, hey, we could do this on our own. Like we should do this. Plenty smart enough, capable, experienced enough in doing these things. And it sounds awesome. So what do we need to do? So that was kind of how that conversation of like, all right, let's do it. We could do this. And we were scared to death half the time, but it's been an exhilarating ride. I'm not gonna lie. So
Yeah. How long did you two plan before you actually like executed?
let's see. So I would say we're still planning. It's like we're always like trying to improve and to grow, because we are definitely you think that you're so like ready for something, but it's a good gentle reminder to be like, there's always more to learn. So that's the number one thing there. Anyways, so we started planning, I would say 4 or 5 months of real just like research and like hardcore like days, like a full days spent like researching different business models, writing the business plan, writing the ideal client, the quote unquote unicorn. Who did we want to go after? And examining, did we want to go LLC? Did we want to go nonprofit? We ended up going nonprofit. Because again, we didn't want to have to turn away services, so we can do paid consulting stuff and also apply for grants to help those that maybe can't afford those services, or employers that can't afford to pay those things. So our soft launch and our hard launch of when we were like, all right, it's done. But yeah, I feel like we're always just constantly, I look back at some of our first initial things and I'm like, oh boy. And now it's, you're like cringing. And then you're like, okay, well, we've come a long way, I guess, like in 5 years.
Yeah, but at least you're continually evolving and just improving on yourself. So what was different between the hard launch and the soft launch?
So our soft launch actually was, we got this opportunity to be on a podcast series last year with, 2 years ago. 2 years ago. I'm sorry, time is blending altogether. It's Groundhog Day in my life. At any rate, we got this opportunity to be a part of the series, and we were like, all right, that's going to be our soft launch. That, like, we had started our social media campaign, we had started doing newsletters, we had a pretty good contact list of people. And we were like, all right, we're going to start launching services. We're going to launch our website. That went through so many iterations too. And I think then the hard launch was when we were like, okay, we're going to start going after grants, and here's our budget, and here's our contacts to reach out to, and like every day just being like really, really litigious, being like sending out message. I'm not an introvert, but I really do not like networking. So this is really a big chore for me to be like, hi, how are you? Like, I just don't like forced interactions, I guess. It doesn't feel genuine to me. So trying to create that. And thankfully, we have a really fantastic business coach who has helped me to reframe my thinking and continue to rethinking on that. So that's probably the two big differences there. So.
Okay. And how much more difficult is it to start a nonprofit compared to an LLC?
Oh my God. Well, let me tell you, so much more difficult. There are so many more hoops to jump through and red lines. I mean, as far as the business side of things, we have been fortunate to have good accountants and attorneys. And then, of course, you have to have a board of directors. So really great people to work with in those instances. But yeah, when you're an LLC, it's kind of like, okay, get some insurance, sign the law, it's like do the licensing, and then boom, there you go. And then file your taxes. Nonprofits, they're like, what's your next 5 years budget going to look like? How much money are you thinking you're going to come expand? Yeah, it's a lot. So worth it, but a lot.
Okay, fair enough. I can't remember where I pulled this quote from, but it says, in today's day and age, women shouldn't have to choose between career and children. Do you want to speak a little bit about that?
Sure, I would love to. I feel very, very strongly that women can choose whatever life that is right for them, and whether that is children or not. if you choose to have children, I do not feel that you should have to choose between the passion and the career that you love and your family. That shouldn't be a thing. And I think so much of our society really tries to push that issue, especially now in the pandemic. I've seen so many statistics and studies and articles that have come out talking about the impacts on this on women. And, it's not about being superwoman and doing it all, right? There are tons of times when it's like, well, house didn't get clean, or oh, that task didn't get done, or man, maybe I yelled too much that day, or whatever it is. But it's about the fact that women should have that choice. And I firmly believe in that across all areas. And women should have the choice to be and do whatever it is that is best for them. So you can see here, I will, and if you can't see it, these are little collars of descent. These are my favorite things. So that should also clarify where I stand on all that. They came just today. I was very excited to wear them for this. So
Well, I'm glad that you're wearing them, and if people are listening to the podcast, definitely check out the YouTube episode to see them.
Yeah, they're so fun. I love them.
Yeah.
Very timely in today's what is it, October 27th, 2020, as we're recording this. So very timely. Very timely.
Yeah, definitely. And thank you for sharing that. That really means a lot. So what does your nonprofit organization do?
Yeah, so we are, well, I won't talk about what we want to do, because that was like my first thing is, oh, we want to do this. No. So what we actually do is we do a lot of consulting work. Yes. So two basic tracks, the easiest way to think about this is that we, at least for right now, we create resources and educational material, and we provide consulting services / trainings and facilitation. We do that in two ways, or for two audiences specifically, colleges, whatnot. So any type of place where you have employees, and then specifically one-on-one or small groups with the individual parents. And we specifically focus on delivering services that drive positive policies, positive health outcomes, and whatever really that organization. I don't want to say too many cookie cutter responses, because with consulting, we really do try to personalize it. And those resources right now, what we're working on is currently, how to, have a parent friendly workplace, policy tips, or, things for managers to consider, or templates to use for, managing work from home or flexibility. And then also making sure that we explain what are the benefits of those, and not just in terms of, hey, this is good for your company, right? But like retention and, attracting new talent, etc., things like that. So those are our main things for them at the moment.
Okay, awesome. And what are like the three main things you would say that employees should do for parents in the workplace going forward?
Ooh, that's a tough one. Okay, going forward, the three main things. I would say empathy is number one. Understanding that not everybody is coming to work from the same place, right? So everybody's got different life circumstances. And that is something that's really important to remember, is when you ask for something like a deadline, and that's okay. Of course, we need deadlines we have to accomplish, but ask yourself, ask your employees, what else is going on? Do they need support? Are they okay? This pandemic is, I mean, whether you have children or not, wherever you are, like, this is a real challenge. So I think empathy is number one. Number two, let's see. These are good questions. I think being willing to have a flexible mindset, perhaps. And what I mean by that is, if the work is getting done, understand that it doesn't necessarily have to get done from 9 to 5 or 8 to 4 or whatever your hours are. If the work is getting done and it's quality, that's what matters. I think that, those old rules of we need to be here between here and here they're very outdated, and they're not helping anybody, especially not now. I think, and then the third biggest one that I would say is really just I think it ties into empathy. It's about caring about your employees. It's about treating them like actual human beings. Like this person is not somebody that's just replaceable. You're not just a number. I genuinely care about you, and I care to, that sounds so fluffy, but it's true, because if somebody is at work and they've got a million other things going on, one of our really popular blog posts that Gian wrote was The Anatomy of a Working Mother. And I love it because it really just addresses so many things that might be on one person's mind. And you just never know what's going on with somebody. So really caring about them and genuinely wanting to know what's going on with their life, because it will impact their work and it will impact their health as well. Because if they're not healthy, they're not going to be able to come to work. So,
Mhm.
it's kind of a hand-in-hand relationship there. I would say those are probably the three biggest ones just for the population as a whole. If we went into different age groups of different, there's more, but those are probably the best ones there.
Okay, well, yeah, thank you for sharing that a lot. Um, so how do you go about finding clients?
Oh, sure. So it depends.
Mhm.
We have gotten clients from collaborations that we've done. We have gotten clients from, honestly, the majority of them have been former people that we worked with or that I worked with in other roles. That's been pretty awesome, honestly, to continue to get to same contacts that maybe had in other roles. Social media is a big one. It helps you to connect with new people.
Mhm.
And let's just be honest, like I said earlier, the thing I hate doing the most is networking. Oh, I love hate it. Gianna's much better at it. She manages our social media as well. So you probably, if you see us over there, it's probably her. So yes.
Well, thank you for sharing that. And I feel like that is a common trend when people say that it is people that they used to work with that they start consulting with and they do work for lots of the time.
Yeah. Yep, it's good to have that warm audience of people and or referrals. That's another one. I always forget about that one, but that's a pretty important one too. Is if you do good work and you ask for a testimonial referral, especially if you do pro bono work, we did a lot of that at first. So the one thing that we asked for, not I don't want to say payment, but when we were doing case studies was, hey, if you would do a testimonial or if you could do a referral or tell somebody else about, like tell 3 other people about us or share a post about the work we've done. Those are some other things that are pretty effective and they don't feel as icky as, hey. No, I'm kidding. I'm kidding.
Yeah, yeah, fair enough. Okay, so your organization held um hosted a conference, an online conference earlier this year. So what did you tell us about the conference just first of all, and like why did you all want to have one?
Yeah, that was a fun brainchild. That was a lot of work. Our yes, the summit. The whole goal behind this was to bring together many thought leaders in the wellness policy, work supporting parents specifically. You could apply a lot of them to other topics, right? Like we had speakers regarding diversity, equity, and inclusion, right? Because um, I don't think we can talk about public health and not acknowledge the, health disparities and the need to address those things. So we talked about mental health. We had people talking about, doing a lot of deep diving into data and a lot of, surveys and information that's coming out. We had someone talk about lactation and pumping and chest feeding, breastfeeding, all the ways that a parent might feed their family. So, and so many others. So it's just so many wonderful speakers, panels of people coming on and talking about policies. It was a 3-day event. It was a 3-day event. It was wonderful. It was a wonderful event. I am so thankful to have been a part of it. That's actually how we met, and you were a part of that, and it was such a great opportunity to get to meet you and have everybody a part of it. So yes.
Yeah, thank you so much for reaching out for me to be on there. I thought it was a great experience, and it was a great panel chatting with everyone, talking about I guess corporate wellness and the importance of like public health and that. And yeah, so thank you a lot for that. I appreciate it. So what were your like biggest lessons learned from this, considering that the conference has passed, and would you host another one?
Yes, I would host another one. I would definitely not do it for 3 days unless it was all recorded content. Um, it was, like I said, it was wonderful. Honestly, I'm actually I would like to go back. One of the things that's on my to-do list is to go back and re-listen to some huge powerhouse, like just, oh, so, I mean, I remember my brain just feeling like it had fallen out of my ears after the fact, just because it was so much information. So yes, I think my big takeaways are, um, start earlier in the midst of a pandemic. I think that things look different from a marketing and a promotion standpoint right now than they did before. Like before, and health promotion is another thing that I've done a lot of, honestly, but all of that is different during a pandemic, and especially when people are so dated with webinars and trainings and virtual this and virtual that. So yes, I think I would do it again. I, in the middle of, would do it all recorded in probably one day. I really enjoyed that we had the library of recordings after the fact if you couldn't attend one, and whatnot. Also, there were only 3 of us doing the entire production. So
Wow.
yeah, that was wild. As you
Yeah.
can see, I'm still like, oh my God, I'm still like, oh, brain fog over that. But yeah, that was that. It was wonderful. Yeah,
Yeah.
so I would hope to do another one maybe in the first or second quarter of the next year. It's just going to depend on where things are.
Okay.
We'll
Awesome.
see.
And what was logistics like planning that? How long did that take to plan out?
Oh my
And
gosh. No, go ahead. Go ahead. I'm just like, oh my gosh, that was
no,
a mess.
you can answer that. That's fine.
Yeah, the logistics. So this is
Hmm.
I'm going to confess, my least favorite part of planning and developing. I do not enjoy it, especially not the technology side of things. It's not my strong suit.
Hmm.
So we started planning, I want to say in April. We originally had the date set earlier in the summer. I also think that's something else is we would probably have I don't think we did enough recon to see who else was having conferences at the same time and thinking about mindset when we started planning it. It wasn't as deep into the pandemic, and
Yeah.
I think approaching that from a different set now. Anyway, so the logistics was tough. Again, thank God for the women that I partnered with of Sutiens out of Boston. They helped a lot. Like they did so much of the technology piece of it because that's really the challenges, right? So coordinating Zoom webinars, all the emails. And we did it all of ourselves. We were like, we're going to bootstrap this. We don't want to spend a lot of money on this. We want to, because we just weren't sure how it would. The first one you're always like, let's. So
Yeah.
yeah, whew, we had meetings, so many meetings, so many virtual, of course, because I'm in North Carolina, they're in Boston, but so much, like so much planning.
Okay.
So.
Awesome. Well, congratulations, and I hope that the next one is a much bigger success. And I guess you probably learned a lot, and you know how to cope during the pandemic with, I guess, how things turn out to be next year. We'll see how all
Yeah.
that goes.
Definitely. Yeah. I joke a lot about humor is my other way of majorly coping. So
Hmm.
I love to joke about like pandemic bingo and like who had the murder hornets, who had, it's just, you got to find the humor in it somehow. So
Yeah, definitely do. So you are currently pursuing your Doctor of Philosophy and Clinical Psychology at Grand Canyon University. Like, when did this thought process for getting this come up?
yeah. So my thought process on this was so I love public health, and I'm
Hmm.
actually in the process of switching because I've just realized that I love public health so much. My original thought process was that I didn't have enough experience with mental health and I'm sorry because I haven't updated my LinkedIn on this, but I figured I'd just bring it up. I'm in the process of, anyway, so I didn't feel like I had enough mental health experience, and I really wanted to expand into that. Mental health is a really tricky field because you don't want to give anybody. There's a lot of ethical and legal and moral obligations, and you don't want
Hmm.
to tell somebody, actually, for me, my world, it's postpartum and perinatal and all the natals anyways. So you don't want to tell a person to do something and then it harm them, and you want your advice to be solid. And there's not a lot of regulation on influencing and whatnot. So at any rate, my thought process was, in going into the maternal health sphere of things, okay, I need a little bit more street cred here with this, and maybe I would take up some patients in that process. Actually, North Carolina changed some of their legalities and laws, so I had to actually switch my program. So that just happened like 2 weeks ago. It's been wild. So shifting gears, going to be doing actually my now master's, which was not in the cards for me.
Mhm.
So focused on mental health, and then working to apply, actually in the process for UNC. They have a maternal and child health PhD program, and I think that would be a better fit. Anyways, again, the laws in North Carolina around mental health and licensing and all those things, they just changed, and
Mhm.
there was no way I could finish my program in time. So
Okay.
by my expected graduation, and they're like, well, do you want to get a degree and go into this, and you can't sit for licensing and all that? And I was like, it's a lot of money not to to get a license. So
Yeah.
no.
Yeah.
Anyways, so just a little shift there. But yeah, I really, um, the one thing that I like about this program that I've shifted into is it's actually it ties so perfectly together with public
Mhm.
health and like examining mental health from that perspective,
Mhm.
and how to talk to communities and how to really integrate this into your care. So, and it is still through Grand Canyon, which is cool. But yeah, it was totally unexpected for me there. But sometimes the universe has other plans for you. So I'm just kind of I'm just kind of riding the wave on that one. That wasn't a Liz thing. That was a Carolina. So
Okay, yeah, yeah. And I know I've heard some weird things about the mental health, behavioral health infrastructure in North Carolina, but I'm also glad that the podcast is getting the update before the LinkedIn profile
I
does.
know, I'm so bad. I haven't. I know it's been on my to-do list for weeks, like the past 2 weeks, and I'm like, well, I'll just address it. It's fine. So it's so funny how those things, like, they line up though, right? And you're just like, well, this makes much more sense, and that's okay and whatnot. So
Yeah, that
it's
that is awesome though, because it does sound like it fits a lot more with what you're interested in, and it does tie together public health and like the clinical side of it too. So that's awesome.
it's really where I want to be. I think if I've learned anything in working in public health, it's just honestly how much I love it. And so I was so burnt after I finished my MPH. I don't know if you could relate to this. After you got out, you're like, wow, I'm really tired now. I'm
Mhm.
really tired. And I'm like, I don't know. I guess I was a little, like I said, I struggled at the health department for a little bit and finding like what was going to be the next best thing. And um, so it's all worked out perfectly, and I can't imagine doing anything else now. So
Yeah, well, I'm glad to hear that. That is definitely awesome. Before I forget, so you touched on it a little earlier about having a business coach. So what was the process for like choosing a business coach, and how has this helped you out?
yeah. Um, so it's actually I highly recommend, like I said, Dr. Huntley. She has the public health and epidemiology. I think I said the name right. Health Careers podcast.
I think so
She's
too.
fantastic. I love her. I cannot speak highly enough to her as a mentor, as a professional. She's just the best. It's like a nice kick in the butt, plus also like your cheerleader. And it's been wonderful. So Gianna and I participate in her group coaching program, and invaluable, honestly. Like, you can listen to and read and get as much information on your own as possible. Highly recommend. But there's just something about having somebody there to actually see and help you walk through it. So, they say you've got to invest your money to make money, and I could not agree more with that. So
Well, I'm glad to hear that. Sounds like a very rewarding experience.
yeah, she's amazing. She's amazing. Such a wealth of knowledge. Such a wealth of knowledge.
Okay, well, that's great to know. So you have another position right now as community alignment specialist at Partnership for Children of Cumberland County. Am I right or wrong?
Yeah, no, yeah, I know. Oh my gosh, my LinkedIn. So working right now on this contract.
Okay.
It's a maternal and child health contract working
Hmm.
to implement a what is it? Okay, universal. I always get this so tongue-tied. Universal newborn home visiting program for the community. So, person who is working to implement that right now and doing
Okay.
all the planning, and we just had a huge meeting about budget and all of that. So, um, fantastic experience. Yep. So, like I said, for me, this year was all about expanding my horizon onto like how can I serve my community and really implement my public health skills to the maximum in child health everything. That was my thought process on the year. So mhm.
Yeah, that's absolutely great. So you also have a certification, CWWS. Is that a certification? What is CWWS?
Certified worksite wellness specialist. There we go. See, I'm always like I'm there's so many acronyms for everything.
Yeah.
So yeah. Um, I actually got that in the working with the Healthiest Maryland Businesses program.
Hmm.
It's just a certification that helps you to connect wellness and the workplace and how do you make those tie-ins and how do you promote it? How do you do strategic planning? How do you analyze budget, make recommendations, all those things. Fantastic. I highly recommend.
Okay, awesome. Is there anything else that you wanted to touch on?
Hmm. No, I don't think so. I'm the big project right now also for me is
Hmm.
expanding into the global health perspective, specifically around again maternal and child. And um, that's a big push right now. It's looking to give back to that global community, whether it's through WMC, whether it's through other consulting, whether it's through volunteer work. It could be that too. We'll see. So that's kind of what I think, I see one of the questions that you asked is where do you see yourself in the future? And I think that's what I would just really like to be known as an expert in the maternal and child health realm sphere because it is just my greatest passion in public health. So and tying all of the stakeholders together in those various communities and organizations.
Okay, that's awesome. And I look forward to seeing you do that. So I'm glad that you said it here and it's going to happen very soon. And we'll have proof of that. So before we move on to the Furious Five, I wanted to ask, like, did you, like, in considering doing this master's that you're going to be doing, is this like going to help your business or do you see it as two completely different things?
Yeah, so that was the big question that I had gotten. Well, when I was examining this, my mom is like the best person to go to for advice. So, anyways, my mom and I were sitting down talking, and I was like, uh, she said, "Well, do you think that you should, discontinue this? Just take the year because um, the UNC process is a year-long process." And I was like, "Well, I've worked so hard for all of this stuff." And so she said, "Well, is there any way to tie it into your public health work and wrap them together?" And that's become the main goal that I have is, and yes, they actually fit really well. Some of they say projected career paths with this work is in public health and community health and whatnot. So that was pretty neat. And so yeah, that is the goal to kind of marry those two things together and to help expand the business. And I mean, for me, I'm also like, well, I've done so much work for all of this stuff. Like it's got to count for something, and I'll be done in a year. So it's like perfect timing. It's like boom, boom, boom. So it kind of worked out like that. It wasn't the plan, and I will admit that I was pretty bummed, but it's okay.
Okay. And what would you say has been the biggest accomplishment of WMC Public Health Consulting so far?
Hmm. I would say it is the families that we have been able to impact and knowing that their lives are better because of the support and resources that we have given to them. I am a results driven person and performance-driven accomplishments, all those things. I love driving for those, but I think in this one, I think this is something you can't really quantify, because I could say, oh, it was the summit, or oh, but really it's the families, it's the women, it's the kids, it's the people that we know are, living a healthier life, being positively impacted. Hearing those success stories, I think they mean the most to me. They're the things that I can't hang up on my wall necessarily, but they're something that I can go to bed at night knowing, like, all right, you're doing something to leave this place better than what it is now. So
Yeah, well, thank you for all the hard work that you're doing, and I know everyone else is very grateful for what you've provided them. So moving on to the last section of the show, the Furious Five. So number one, what advice would you give to a student trying to pursue a career in public health?
don't give up. It's going to get hard. There are challenges, especially if you go into graduate work. It can be really challenging. Find your passion and stick with it, and don't give up. It's so worth it, and it's so rewarding when you get to the other side of it. Like I said, I remember I remember how tiring it can be in that moment, and I think that would be it. Just keep going.
Okay. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Believe in yourself. Your imposter syndrome is going to kick in. Actually, I also learned today that that's like a real thing, which people with dementia and Alzheimer's often experience. Anyways, but imposter syndrome in the mindset category of everybody has this happen. You'll have the negative self-talk. Continue to tell yourself that you can, because you have a unique perspective and an expertise that is valuable, and somebody will relate to it, and just keep going.
Yeah, awesome. Thank you. Number three, what's something you're working on improving in your life right now?
Patience. Patience. No,
That's a good one.
I would say, yeah, my mental health is one that I am the biggest one, probably. So taking up therapy is great. Meditation and journaling, those are the three biggest things that I could do for myself right now, just in the middle of a pandemic, and trying to cope and excel and just move through.
Okay, thank you for sharing that. Number four, professionally, do you recommend anything?
Oh yes, so many things. I feel like I should give you a whole list.
You can give me a list afterwards if you like, and just mention a
Yeah.
couple of things now.
I would say so professionally, I would say get involved with the community that you're part of. And there are some fantastic people doing this work and this community that are so uplifting, and their work will inspire you. And I would say get in touch with those influencers. I think of Christy Van Horn, Shelby Graves, just to name a few. There are just so many. And Amanda Howell, I hope I said her last name right. Some of the guests that you've had on your podcast are fantastic. Podcasts. I love Johns Hopkins. Love their podcast. Huge fan. Depending on what else you might be juggling in your life, there are, if you want to start a business and you're a female, Biz Chicks is great. She has all the answers. It just depends on what you're interested in. And read all of them. Just have a growing reading list. Like just keep pushing forward with those. If there's an area that you feel like you're weak in, try to dive in to those areas and immerse yourself.
Awesome. Thank you for sharing those, and I'll be sure to link all of them in the show notes.
I know, I'm like, oh my gosh, book list. Like, can I just send you my Goodreads?
You can if you like. We can make Goodreads.
It's the best app ever. I don't care what anybody says. It's better than any other one.
Yeah, I've only started using it like a couple months now, but I'm enjoying it a lot. Yeah. So last but not least, where can people connect with you?
Oh yes, please connect with me on social media. I don't really use Facebook a whole lot. That's just pretty much family stuff. It's pretty boring, and memes, super silly memes. So I would say probably Instagram or LinkedIn are the best ones. Also, if you are a working parent, you're interested in the community, you're welcome to join our community. That was kind of how WMC all started, was the Facebook community, really starting to reach out with that village. So welcome to join that too.
And what is WMC's handle on Instagram?
theworkingmama.co. And I'll tell you one more like fun little fact. WMC, it's actually the Working Mama Collective was the name of our group. So our consulting, we didn't want to do our names. We were like, those acronyms don't work for us. So we did WMC Consulting, Public Health Consulting. So there you go.
Okay. We're getting the best fun facts out here.
Yeah.
That's awesome. Well, I'm glad that we got to sit down and chat, and we got to hear about your story, and I'm sure that people are going to get a lot of value from it. So thank you so much for joining me tonight. And I can't wait for people to listen to this episode.
Thank you so much. It was an honor to be a part of it. Thank you for having me.
Yeah, my pleasure. Well, I really hope you enjoy that episode with Liz, and I know that I have a lot of other exciting episodes to come, but I know Liz dropped a lot of value, and I'm just glad to be able to share her story with all of you, and I hope this was helpful, and I continue to push to give you all valuable content, and hoping to keep on recording and just keeping the show consistent from now on, as I did have a couple of stops along the way. But thank you so much for listening, and if you have not as yet, definitely leave a review, subscribe, follow me on Instagram. Thank you. Public Health Millennial out.